Welcome back friends, welcome back in another video tutorial from microbiology with Charlie. So in that video tutorial I am going to discuss about two kind of protozoan disease. One is malaria, another one is Kala-azar. Okay, so let's get started with the malaria. I think you all know that malaria is caused by mosquito, right? But it is not that. Mosquito just play a role of delivery boy here. The main culprit of malaria is a protozoa named Plasmodium. Okay, so there are 5 types of protozoa available that can cause malaria. So Plasmodium vivax, which is the most common one and widely distributed. Plasmodium falciparum, it is also common and it causes serious disease. Then Plasmodium ovale, Plasmodium malari, and Plasmodium knowlesi, which is confined in Southeast Asia. Okay, so 5 type of protozoan, the Plasmodium species available that cause malaria in the human. So among them Plasmodium falciparum and Plasmodium vivax are the most common one, and Plasmodium vivax is the widely distributed and Plasmodium falciparum is the serious one. Among with them we have Plasmodium ovale, Plasmodium malari, and Plasmodium knowlesi. Okay, in Southeast Asia. So let's talk about the transmission. So I hope you all know what is the mode of transmission, right? So it is typically transmitted through the bite of an infected Anopheles mosquito, more commonly through the bite of female infected Anopheles mosquito, because female requires blood meal for their egg maturation. Remember that male Anopheles mosquito cannot bites human and they cannot cause any kind of malaria, and it is transmitted from pregnant women that infected with malaria to the child, that is known as congenital malaria. Okay, because remember here there is a step which is totally going on in the blood. Okay, so any kind of blood transfusion can cause malaria. For example, organ transplantation, blood transfusion, use of infected needles. Okay, so 3 type of mode of transmission we have learned. First one is through the bite of infected female Anopheles mosquito. Second one is through infected pregnant women, that is known as congenital malaria. And the third one is through blood transfusion, through organ transplantation, through use of infected needles. So what are the symptoms? You may observe splenomegaly, enlargement of the spleen, hepatomegaly, renal failure, pulmonary edema. Most important is these 3 fever, chills and sweating. That is the characteristics of malaria. You may observe every 3 to 4 days fever, chills and sweating if you are infected with malaria, along with hemolytic anemia, jaundice, extreme fatigue. Okay, so we have learned until now that malaria is caused by a protozoa known as Plasmodium. Okay, so among various species of Plasmodium, 5 species mainly cause malaria. For example, Plasmodium vivax, which is the most common one and widely distributed, Plasmodium falciparum, which is the also most common one, and here the Plasmodium falciparum is most severe, along with Plasmodium ovale, Plasmodium malari, and the last one, that is the newly included, that is Plasmodium knowlesi. And this Plasmodium knowlesi species is only confined in Southeast Asia. So mode of transmission we have learned, that is it is typically transmitted through the bite of mosquito. It is transmitted from pregnant women to children via congenital, which is known as congenital malaria. It can be transmitted through blood transfusion. Then we have learned the symptoms in splenomegaly, hepatomegaly, pulmonary edema, renal failure, fever, chills, sweating, hemolytic anemia, jaundice, extreme fatigue. Okay, so diagnosis: blood test can be done to determine which kind of parasite infects you. So this is the Plasmodium life cycle that you need to know a little bit. So you can take a screenshot of that. Although I am going to explain Plasmodium life cycle in more detailed way than this one. So let's start. First of all, female mosquito will penetrate our human skin. Why? Because it requires blood meal, right? And during that time it also have to inject saliva. Why? Because remember, its saliva is mixed with anticoagulant that prevent blood coagulation, and that is important for mosquito, right? Because it needs blood meal. Okay, so if that particular female Anopheles mosquito unfortunately infected with Plasmodium, then along with saliva mixed with anticoagulant, it will also inject elongated sporozoid into the bloodstream of human. Okay, so the female Anopheles mosquito first penetrates the skin for its blood meal. During that time it injects or saliva that is mixed with anticoagulant, and if it is infected with Plasmodium, then along with saliva and anticoagulant it will also secretes or also injects elongated form of sporozoid, okay, which is asexual form of Plasmodium. Okay, now let's move. The sporozoid travel to the liver where they enter liver cell, right, and rapidly divide asexually. This asexual division, which is called schizogony, generate the next life cycle called merozoid. Okay, that means sporozoid will travel via bloodstream into the liver, and into the liver they, in the hepatocyte, that is our liver cell, they start multiplying asexually. Okay, and this asexual multiplication is known as schizogony, and this schizogony will give us merozoid, the next life cycle form called merozoid. Okay, then the released merozoid invade either liver cell or it can go to the host bloodstream and invade erythrocyte. Okay, so what happened up to this point? First of all, the female Anopheles mosquito penetrates the skin, and during this penetration it injects saliva which contains anticoagulant, and if it is infected then it also contains elongated form of the sporozoid, right? Now this sporozoid will migrate through the bloodstream into the liver, and in the liver it enters the liver cell hepatocyte and starts asexual multiplication, right? And this asexual multiplication process is known as schizogony, and this schizogony will produce merozoid. Okay, now this merozoid have two options. It can invade the liver cell and starts and continue multiplying its number, or it can enter the bloodstream and invade erythrocyte. Okay, now inside the erythrocyte it become enlarged. Okay, and this enlarged uninucleated cell is known as ring tropozoid. Okay, the tropozoids, inside the tropozoid the nucleus then undergo asexual division, which result in the formation of a cell which contain multiple nucleus or nuclei. So the cell containing multiple nuclei is known as zygont. Okay, so again the reproduction that produces zygont is known as schizogony. So up to that point we have learned that female Anopheles mosquito will inject the saliva containing anticoagulant along with our elongated form of sporozoid. This sporozoid will travels through the bloodstream and enters the liver, and in the liver it will enters the liver cell, and inside the liver cell it will multiply, right, asexually, and this asexual multiplication is known as schizogony, and this schizogony will give us merozoid. Now this merozoid can either go into the liver back for increasing its number, or it can invade the bloodstream and enters inside the erythrocyte. If it enters inside the erythrocyte, then it will increase its size, result in the formation of uninucleated cell called ring tropozoid, and inside the tropozoid there will be division of nuclei which result in the formation of multinucleated cell called cygont. Okay, now this cygont will divide and leads to the formation of mononucleated merozoid. Okay, then the erythrocyte ruptures because mononucleated merozoid will be large in number, which ultimately leads to the rupturing of the erythrocyte and releases a toxin called hemozoin. Okay, this hemozoin will releases throughout the body, and that is the cause why you, in case of malaria, you observe series of fever chills. Okay, or you can say cycles of fever and chills. That is the characteristics of malaria. During malaria, the cycles of fever and chills can occur in every 3 to 4 days. Okay, so up to that part, this was the asexual phase, that is especially going on in human. So first of all, female Anopheles mosquito will penetrate the skin, and then it will inject the saliva. Inside the saliva it contains anticoagulant, and if it is infected, then it also contains elongated sporozoid. This elongated sporozoid will travels to the liver, and in the liver it will penetrate the hepatocyte, and in the hepatocyte it will undergo asexual multiplication, a process called zygogony, and this zygogony will give us merozoid. Now merozoid have two options: either it will go to the liver to increase in its number, or it go to the bloodstream and enters erythrocyte. In the erythrocyte it will enlarge itself, result in the formation of enlarged uninucleated cell known as ring tropozoid. Now this tropozoid will, inside the tropozoid, the nucleus will start divisioning, that is known as result in the formation of multinuclei containing cell called cygont. Okay, and this kind of reproduction is known as zygogony. Okay, now after that zygogony will undergo division and leads to the formation of mononucleated merozoid. Okay, and this mononucleated merozoid will be high in number, and as a result the erythrocyte ruptures, and which releases toxins called hemozoin, okay, throughout the body. As a result, cycle of fever and chills occur. That is the characteristics of malaria fever. Now not all merozoid will rupture the erythrocyte, you know. Some of the merozoid will convert into a gametocyte, entering into the sexual phase. Okay, and inside the erythrocyte, the gametocyte do not cause the rupturing of the cell. Okay, it remain inside the erythrocyte, and it have the ability to convert into gametes, but it cannot do this inside the human cell, or it can inside the human body. So now under such circumstance, if that infected person is injected by or again bitten by another mosquito which is uninfected or any kind, those mosquito will suck blood. Along with that blood, it will also suck the erythrocytes that contain the gametocytes. Okay, and inside the gut of the mosquito, those gametocytes will convert it into male and female gamete. The male gamete will be known as microgamete, and the female gamete will be known as macrogamete. Okay, and this male and female gamete will ultimately develop zygote within the intestinal wall. Okay, and that further differentiate into oocyst. This within the oocyst, continuous mitotic division will be going on, producing large number of sporozoid. I hope you can recognize what is sporozoid, right? Obviously, this sporozoid now will migrate to the salivary gland of the mosquito, and then next time when this infected mosquito will again bite a human which is uninfected, then this sporozoid will be transferred to those human blood along with the saliva and anticoagulant, thus restarting the cycle. That is how the cycle is going on. So that is what I have represented here diagrammatically, and I have also explained it. So if you have followed my explanation, then I hope you can understood it very well. So let's try to recapitulate it. First of all, the female Anopheles mosquito will inject inside the skin, and during this time it will inject the saliva which contain anticoagulant and the elongated form of sporozoid, right? And during this, this sporozoid will travel via blood into the liver and enters inside the liver cell, hepatocyte, and in the hepatocyte they will undergo asexual multiplication known as cytogeny, which gives us the first another form of life cycle, that is merozoite. Okay, now this merozoite can either enter the liver or it can invade the liver and go into the bloodstream, where it invade the erythrocyte, and in the erythrocyte it will be enlarged, leads to the formation of uninucleated cell called ring tropozoid. This ring tropozoid, or inside the ring tropozoid, the uninucleated nuclei undergo division, which result in the formation of multiple nuclei containing cell called cygond. Now this cygond will undergo division and leads to the formation of mononuclear merozoite. Now this mononuclear merozoite either ruptures the erythrocyte, releasing hemojoin toxin. This hemojoin toxin is the cause of the cycle of fevers and chills that occur every 3 to 4 days of a patient who is infected with malaria, right? That is the characteristics of malaria. And some of the merozoite, instead of rupturing the RBC, converts into our gametocyte. That means it is entering into the sexual phase, and inside the erythrocyte, the gametocyte remain intact despite rupturing the erythrocyte. And when the another mosquito will inject the blood again, it will or will suck the blood again, along with the blood it will also ingest the erythrocyte containing our gametocytes, right? And then inside the mosquito gut, the gametocyte will be converted into male gamete and female gamete, and this male and female gamete ultimately develops the zygotes within the intestinal wall. Okay, and this zygote will be differentiated into oocyst, and this within the oocyst there will be continuous mitotic division that leads to the formation of sporozoid, and this sporozoid will be transferred to the salivary gland, and it is ready to infect another human or another uninfected human with the help of its saliva. So that is the entire cycle of Plasmodium. Now let's move to the next part, that is the treatment. So here we need to keep in our mind about the drug resistance. Okay, so if you are infected with chloroquine sensitive Plasmodium falciparum and malaria, then we can do our job with chloroquine that can be applied oral. Chloroquine sensitive Plasmodium ovale and vivax can be controlled with the help of chloroquine along with the primaquine, which is inserted orally. And if glucose 6-phosphate dehydrogenase deficient is present, then there is no need to use primaquine. Okay, so then chloroquine resistant with uncomplicated infection, coartem and meladone can be given orally, and chloroquine resistant Plasmodium falciparum with complicated infection, artesunate quinidine can be given intravenously. Okay, so 4 kind of drug. If chloroquine sensitive Plasmodium falciparum and Plasmodium malady is there, then you can give chloroquine orally. If chloroquine sensitive Plasmodium malady and Plasmodium vivax is there, then you can give chloroquine along with primaquine, which can be given orally. And if glucose 6-phosphate dehydrogenase is present, then primaquine is not required. Then chloroquine resistant with frequently uncomplicated infection, then we can use coartem meladone, it can be given orally. Along with that, chloroquine resistant Plasmodium falciparum severe complicated infection can be given artesunate or quinidine intravenously. Okay, now let's move to the preventive measure part. So we can use mosquito netting, we can use window screening, we can use protective clothing, we can use insect repellents, we can drain out the stagnant water in swamp and ditches, that will reduce the breeding areas. Okay, and carrying appropriate medicine during traveling in endemic areas is also a kind of prevention. Okay, so use of mosquito netting, use of mosquito repellent, use of protective cloths, and drainage of stagnant water in swamp and ditches reduce the breeding areas, and carrying appropriate medicine in endemic areas will also help us. So that was the concept of malaria that we have completed. Now we will go to another kind of protozoan disease, that is Lisbenia, but here we are only going to touch the Kala-azar. Okay, we are not going to discuss about cutaneous Leishmaniasis or mucosal Leishmaniasis. We are only going to discuss about visceral Leishmaniasis. So Leishmaniasis is again due to a obligate intracellular parasite. Leishmania donovani and Leishmania infantum are frequently infecting species. So it can infect a insect known as sandfly. Here again female sandfly is playing the role of vector here, because she requires blood meal for her egg maturation. So during that blood meal taken, it will transmit the Leishmania parasite into human, and the sandfly can be infected either by Leishmania infected animals, that can be rodent, dog or foxes, or can be Leishmania infected peoples. Okay, and there can be a small chance that Leishmania can be directly transmitted through blood. Okay, why small chance? When I am going to discuss with you about the cycle of the Leishmaniasis, you can understand that there is no direct contact of blood, right? So Leishmania transferred through blood is rarely observed. So Leishmaniasis is due to the obligate intracellular parasite Leishmania. The two important species here are Leishmania donovani and Leishmania infantum. Here infected female sandfly can transmit the parasite into the human, and sandfly itself infected by Leishmania infected people or Leishmania infected animal, for example rodent, foxes and dogs. So there can be 3 kind of Leishmaniasis: cutaneous, mucosal and visceral. Okay, but in our syllabus we have only visceral Leishmaniasis, that is commonly known as Kala-azar, and it is also the more severe form of the disease. That means it is the most important one. So as a symptoms you may observe episodes of fever, weight loss, anemia, enlargement of the spleen is the most common symptoms, and liver. Okay, so episodes of the fever, weight loss, anemia, enlargement of the spleen and liver. So if you compare the symptoms of Leishmaniasis with malaria, then you can observe remarkable similarities. Here also we can see enlargement of the spleen and liver, and we have also seen this in malaria also, anemia, and in case of malaria it was hemolytic anemia along with weight loss and episodes of fever. Okay, so what are the diagnostic? So diagnosis can be done by blood test that looks for antibody. PCR can detect the parasite, or by urine testing, or by identifying the parasite directly via microscope. So treatment is liposomal amphotericin B can be applied with the help of type 4 infusion, and prevention is quite similar to the malaria. And one important prevention is avoid outing when the leishmaniasis is active, that is the time between the dusk and dawn. Okay, and various vector control program is used to eliminate the reservoir of the disease, and no vaccination is available. So this is the cycle of the leishmaniasis. It all starts when a sandfly inject promastigote stage into the skin of during its blood meal collection. Okay, so remember that in case of malaria, mosquito, mainly the female Anopheles mosquito, transfers porozoite form of Plasmodium, and sandfly transfers promastigote form of leishmaniasis. This is the important thing you need to know. So promastigotes will be phagocytosized either by macrophage or either by any mononuclear phagocytic cell, and inside the phagocyte it will be converted into amastigote. And in case of malaria, the first form that is generated in the human was merozoites, right? And here it is amastigote that is going on inside the macrophage. Try to understand. Along with then amastigote multiply in different cells of various tissue and infect other cells also. Okay, but amastigote now cannot convert itself back into the promastigote. For that reason it needs a environment that can only be provided by the gut of the sandfly. So when sandfly takes the blood meal, again it will ingest the parasitic cell, and inside the mid gut of the sandfly the amastigote will be converted into promastigote again. Okay, and that is how the cycle will be going on. So in leishmaniasis it is all done by a obligated intracellular parasite known as Leishmania. Important two species are Leishmania denovani and Leishmania infantum. Okay, so there are three kinds of leishmaniasis: cutaneous leishmaniasis, mucosal leishmaniasis, visceral leishmaniasis. Among them, the visceral leishmaniasis is the most important. What are the mode of transmission? So mode of transmission is via the bite of female sandfly, and female sandfly itself become infected by another leishmania infected animals such as dog, rodent, foxes, or by leishmania infected people. There can be a very small chance that leishmaniasis is transferred directly through blood. Okay, now what are the symptoms? Enlargement of the liver, spleen, episodic fever, along with you may observe weight loss, anemia. So incubation period is 10 days to 1 year after the bite of the sandfly. And diagnosis test, blood test that look for antibodies, or urine testing. PCR can detect the parasite, or detection of the parasite with the help of microscope. So prevention, we have to avoid biting of sandfly. Along with we can use bed net, we can use insect repellents, we can use protective clothing. Along with we have to perform various kind of vector control program that will eliminate the reservoir. No vaccines available, so we have to be very careful. Along with liposomal amphotericin B can be used, which is inserted via type 4 infusion. So sandfly first transferred the promastigote form of leishmania. Okay, and this promastigote will be phagocytosized either by macrophage or either by any kind of mononuclear phagocytic cell, and inside the macrophage the promastigote will be converted into amastigote, and this amastigote can infect various kind of cells in same tissue or other tissue, and it will keep on doing this until another sandfly will come and again suck blood, and during this blood sucking you will ingest the macrophage which is infected with amastigot. Okay, and during this time it will again take the chance of conversion into promastigot in the gut of the sandfly. Okay, and then it will be again transmitted via sandfly, and the cycle will be goes on and on. So that is the concept of Leishmaniasis. So I hope this video will be helpful to you to understanding both the concept of malaria and Leishmania. So thank you for listening to this class.